Good afternoon, everybody. Welcome to this afternoon session of Biahad Together, spirited by AJU. This is American Jewish University's offerings in a time of crisis, trying to provide perspective and learning, and hopefully some interesting intellectual distraction. Today's session is Viral Journalism, the Challenge of Reporting a Pandemic. My name is Dr. Rich Potter. I am the chair of the Media Arts Department at American Jewish University, and I am very grateful to welcome two national desk correspondents from NPR with me today. We've got Leila Fadel and Kirk Siegler. Leila is currently based in Los Angeles, where she covers issues of culture, diversity, and race. She was previously NPR's international correspondent based in Cairo. She covered the wave of revolts and their aftermaths in Libya, Tunisia, Egypt, and elsewhere that we know as the Arab Spring. And previous to that, working for Knight Ridder news service, she covered the Iraq War. Kirk Siegler is based in Boise, Idaho. He covers rural life, culture, and politics, focusing on the American West. He has covered land use and management in the West, including controversies around that, including some of the standoffs that have made news in Oregon and elsewhere. And both reporters cover breaking news as it happens. Kirk has covered the wildfires in California, as well as the 2015 major earthquake in Nepal and other natural disasters. So I think they bring us a lot of perspective on the current situation, both in terms of how it compares to previous crises that they've covered, how it differs, and what it's like to be inside a news organization that tries to adapt to something that is truly unprecedented. I've got some questions that I'm very curious myself to put to Leila and Kirk for the first part of our chat, and we'll have a little conversation. And then we'll open it up to questions from the audience that is joining us today. We're really glad that you're here with us and taking some time to learn with us. And we'll spend the last 15 or 20 minutes of the session answering your questions. We'll go about 45 minutes today. So Leila and Kirk, first of all, thank you so much for taking time out of what is clearly a very busy schedule and one that's changing minute by minute. So if you could maybe just enrich us a little bit more than I did in the introduction, tell us a little bit about your journalistic background and your duties at NPR and the beat that you were covering before this pandemic broke and everything changed, so we can have a sense of where you were and what's going on now.
Who goes first? Or I'll go first. So I actually just moved to Idaho, Boise, from Los Angeles about 5 months ago, but mostly to more closely cover rural culture and life and the urban-rural divide in America. And, you know, I guess in answer to your question about how you teased how the news organizations are handling this, this is like, you know, it's becoming cliche, but this is like nothing we've ever encountered before. If there was one bit of, you know, solace in that, it's that we've gotten pretty used to a fast-moving news cycle, particularly under the Trump administration, where things seem to change by the hour. And so now we're facing a story where things literally change by the minute. And both Leila and I are correspondents. We are, you know, by nature, we are the people who are out in all of the communities, traveling around constantly, doing stories from the ground, not always doing stories about, you know, the policy, the think tank, the politician in Washington. It's our job to be out here in, you know, America, telling all of the stories from the ground up from America that are often quite a bit disconnected with what's going on in Washington, for example. So this is a very unique challenge where we would normally be doing that. I would normally be covering rural America. And then suddenly I can't really leave my house like everybody else.
Leila, where do you find yourself right now?
I'm also in my house. You know, I've covered, as you mentioned, I covered the Iraq War for the Washington Post for McClatchy, for NPR. Took Mosul. I Kirk and I have both covered a number of natural disasters, mass shootings in the United States, stories that I would say are devastating for communities, dangerous at times to cover. But the difference here is that the lockdown now is not just about our personal safety of a society at large. When you go outside, you may be carrying a virus with you to other people. You may be taking equipment from medical workers that need it while you protect yourself to go out and do stories on them. You can't embed in an emergency room, for example, any longer. You could do that slightly at the beginning of this epidemic when it wasn't as clear how quickly it spread. Because how does the hospital protect you? How does your company protect you? And so we're faced with trying to tell the stories, this really global story that is in every single community, rural, urban, every refugee camps, every country, but do it without being able to just go outside and interview people willy-nilly. Every time you move outside the house, the idea is this necessary? Is this absolutely necessary? Is the risk worth it? This is something I definitely thought about in Baghdad a lot. We would only go out for certain types of
Leila, let me jump in before you tell that part of the story. Some of our audience are saying that your vocals are low. So I don't know if the fix is to maybe move a little closer or speak more loudly.
I'll speak a little
but I want them to hear what you're about to say, especially.
Does that work better? If somebody could let me know if you're hearing me better. Okay.
So I think
we might be okay. A little better. All right. I'll just keep speaking up a little bit. I'm a quiet talker. I usually need much higher volumes on my mic. So in Iraq, when I lived there for almost 5 years. We did lock ourselves up to a certain extent. We didn't live in the green zone. We lived in the city, but every time I went outside, I had to ask a security person, is this worth it? Am I allowed to do this? We went out in 2 cars. We went out for 20, 30 minutes because we were scared of certain things, kidnappings, bombings, things that people in Iraq were living with. But there was an exit. You could go to another country, another place, and it wasn't happening there. This is a global pandemic. There is no place where COVID doesn't exist. So it's a completely different dynamic that I don't think any of us have ever had to cover in this way.
Yeah, I was going to say, usually we're used to jumping on the plane. I don't have a go bag packed, but some of us are used to, 5-10 minutes, get your luggage and book a flight and run to the airport. And with this, it's been kind of like, at least early on, it was like, okay, so are we going to Seattle? You need me to hop the shuttle flight over to Seattle right now? And the response has sometimes been, well, that's the hot spot now, but in, another day, it could be in your community. For instance, I'm here in Idaho, and 2 counties away is, one of the epicenters for the coronavirus in the rural West, which is Sun Valley. A lot of the ski resorts have been early places because there's a lot of global movement, a lot of tourism, a lot of wealthy people traveling all around the world. One day you're in Dubai, then you fly to your place in Aspen, seriously. And so our editors will be like, well, as soon as you get on the plane and go to Seattle, maybe you help out there, but then your risk of infection is high. Then you're out at best for 14 days. We don't have you as a reporter to report on the biggest story in the world, if not our lifetimes, for 14 days at a minimum, because you'd have to self-quarantine. Or if you got sick, it could be longer. So it's a real, it's sort of it sort of runs counter to, with the exception of the extreme example there that Leila had in Baghdad, it sort of runs counter to our intuitions and our instincts, I guess, as journalists, where we usually run into the fire when everybody else is trying to run out because we want to tell the story, or we have to tell the story. Instance, like, how many times has Leila or I been on a flight that's like the last flight into Miami, for example, when everybody is fleeing Miami because of the approaching hurricane, and we're like getting the last commercial flight in. This story, you can't do that. The case of Sun Valley, I was thinking I'd go report the story because it's about a 2.5-hour drive until I talked to the 2 doctors at the hospital, one of whom has it, who was like, do not come here. You will get it. Like, you have to stay away. And so that was kind of the wake-up call. Like, we literally have to report from our houses, with a few exceptions, at least so far.
Yeah, and Leila was mentioning earlier that part of that that caution is for your own safety, and part of it is because, unlike in other situations, you actually could be carriers and thus a threat. So there's an ethical consideration here that would be different than rushing into a battle scene, perhaps, or the aftermath of a disaster.
Exactly.
How is it working inside NPR right now to determine where you go and when it's important enough, and what stories you're covering and where they want you? What does it look like organizationally? What are your conversations with your editors like?
The decisions on when to go out to do field reporting in that way are actually made on a much higher level at this point. So we don't just we have a larger conversation about movement, whether we should be or should not be going out for those stories. So that's definitely different. And obviously we're trying to cover the story as it appears. This is not a story where we can think about it for a long time. We have to cover what's happening in the midst of New York as we watch the Michigan governor beg for help. New Orleans now also popping up as an epicenter. California prepping for what could be the worst projection, but also we don't know. And so I think as a national desk, we're really trying to put our head and hands around the story for our shows. They've also started several different initiatives to try to do a public conversation, because this story, like unlike most other stories, is inside every community and every home, from the economic impact to the public health impact, to just daily mental health, to having babies. Like every facet of our lives has changed, including the way we report. And so also we are having conference calls to discuss our editorial, because the most of us non-essential are working from home. It's just the nature of every single industry at this point that we have shifted how we work, and both because we want to protect ourselves, but ethically as journalists, we don't want to be part of spreading the problem, and we while continuing to do the public service of journalism and making sure people are informed.
So what stories are you working on now, and have you been working on over the last 2 weeks? And how are those decisions made? Go ahead.
So I cover rural America and largely by default conservative America. So I have been, perhaps, and Leila, correct me if I'm wrong here, but perhaps a little bit easier for me to take my beat over to this crisis. Perhaps. So she'll correct me if I'm wrong, but I, cover small towns that feel disaffected, or some of whom are very struggling very much and don't have enough resources, or maybe they don't have the resources to the right thing, or maybe they're very isolated and struggling to keep up with the current economy. Well, this global economy, or what was, this highlights that. Many rural hospitals have closed in the last few years in rural America. So you've got a situation where you may be, in this story, you may be a little bit more isolated, and the transmission and infection risk might be a little bit lower, or maybe not. It just takes that one person who went through the SeaTac airport and traveled into Grangeville, Idaho, and then went to the grocery store and had it, and all of a sudden you've got a pandemic in your small town. So what I've been looking at is how this has disrupted that entire system from a procedural standpoint. Whereas a small hospital, if your community is lucky enough to have a small hospital, they typically transfer. They don't have an ICU. They typically transfer their patients to larger regional hospitals if you're critically ill, and they don't have ventilators. So what happens when those regional hospitals that you normally fall back on themselves are full of COVID-19 patients? Another angle we've been looking at pretty strongly is the President Trump's messaging, particularly up till about a month ago, calling this a Democratic hoax. There being a real sense in some rural communities, although I cannot say this is one big monolith, there being a sense, at least the last time I left my house and drove 4 hours to a small town a couple of weeks ago now, there being a sense that, well, this is an election year, this is just politics, this virus is not as big of a deal, which you're hearing directly from in some of the White House briefings. So I've been covering that. So, and also looking at basically, you mentioned in the introduction that we have I cover a lot of standoffs and the militia and so-called patriot movement, a real detection of early defiance against these. I'm talking to you from one of the reddest, most conservative states in the nation that last week, the governor here also made a mandatory shelter-in-place order. That doesn't necessarily sit. You can imagine how that may sit with some of the right-wing militias who are already starting to organize.
Because I read your Twitter thread about it, and that some of them are taking it as an affront to their liberties. Is that a story that can make it to the air at NPR?
Oh yeah. It's a story we're working on. We did the story the other day, kind of touching on that, looking at how this has moved from and how the movement itself is split. It started out kind of as this is a conspiracy, like blatant conspiracy theorists. This was created in a lab by the government to control us. To now it's moved. You've watched the response move to, you can't tell me what to do to protect my family. I know how to protect my family from a pandemic. And let's face it, some people in this movement already were so-called preppers and ready for hunkering down for months at a time. It's been interesting to watch that shift, but just like many other stories, it's also, we have an internal question in our newsroom. Do we cover this? Are they really doing anything? Do we really amplify their voice? Are we giving them too much of a voice at a time when Leila's in Los Angeles or our colleague Hanzila Wang is in New York, where the hospitals are completely overwhelmed and they do not have enough supplies? So we're having a difficult time, I'd say, candidly, figuring out how to track this story because it changes all the time, and it's not necessarily a national story. It's a local story and a global story. Everybody, if you were to say, like, this crisis is happening in New York, people are like, well, it's happening in Boise too, and all the businesses are shut down on my street. So I want to hear about those.
Well, on that point, when I was reviewing, Leila, the work that you've done on the pandemic, definitely you're involved in keeping everybody updated on what's going on in California on a day-by-day basis. But I saw that you also had some stories about family services and the effect that this is having on children in foster care and parents who are trying to maintain contact with them, which struck me when I looked at that story as something that I'd not considered at all. That's obviously extremely important for these families and the people working in family services. And also brings up that question as to, how much time do you devote to that when you have a limited time and resources? So how did you come to report that story?
Well, I think that the important thing is that the disruption of life is happening on every level, right? So when you go into this lockdown mode, it doesn't just impact your, let's say, job loss or having to stay at home or not being able to work out, all this stuff. It impacts the court system. It impacts the prisons, which there's more and more people being released. It impacts child services. It is a situation where possibly domestic abuse or maltreatment can flourish because at this point there are less people out there spotting this. In that story, I talked about how schools are first reporters in many cases when you see a child possibly being mistreated, and now schools are out. So there is concern that some of that stuff can thrive. It's also an extremely racialized moment, which we've seen from the White House on down, referring to this as a Chinese virus or a Wuhan virus, which has been detrimental to Asian Americans. So it's a very difficult moment because we're in the breaking news portion, we're in the public health portion, but it's also bringing up questions of that delicate balance you walk between civil liberties and public health. It's bringing up questions again about race and health. So, for example, in Seattle, I did a story about a quarantine site. This was pre-declaration stay-at-home orders, and it was about why this quarantine site ended up in this poor, more brown and black neighborhood and not other neighborhoods. So, I think in many ways, the bigger stories of the impact of this moment will be coming. And right now we're still in the phase of just reporting how hospitals are keeping up in order to not turn into to New York now and Italy and Spain, but meanwhile also trying to do all these other stories that look at the human face of the virus, how it impacts just a family, and then the larger questions of economics, race, access to childcare, to your own child, and how this might discriminate, how resources might discriminate between urban and rural, racial, different socioeconomic classes. So all of those things are things I think that we will be covering in the long term for months. This is not a story that is a couple weeks of breaking news. This is ultimately probably going to shift us as a society, and we'll have to continue to cover those.
And as Kirk mentioned earlier, even before this pandemic, we were in an extremely accelerated news cycle. Things happened very fast. And we are a society now where we are obviously extremely polarized, and we read the political implications of things extremely quickly. They play out in our media spaces, as fast as they happen. So it brings up this question in terms of being reporters through NPR, which also has, for better or worse, truer or falser, a political identity. This came up recently where the affiliate station in Seattle announced that it would no longer be carrying President Trump's briefings live. The logic behind that, as I understand it, is that they felt that there was a certain degree of misinformation that they could not correct quickly enough to carry them live, and so that they would rather report on it and be able to provide journalistic due diligence on that information. What is it like to report this as an NPR reporter? What kind of reactions do you get? And I imagine, Kirk, that where you are in a red state talking to militia members, maybe that plays out more, but I don't know, Leila, maybe you'll surprise me with what you'll say.
Who's taking that first?
Kirk,
I'm often, yeah, I'm always surprised. I shouldn't say I'm surprised because I'm not, but we are much more listened to than you might think in a rural red state. I obviously don't just cover Idaho. I was in a lot of the West and the West Coast and the Midwest, frequently in smaller towns. But, we do have, in some places, we are the only news on the radio. So I would say, yes, it does play into that. The polarized moment. People, what I'm detecting even more is this just almost less of polarized and more of, we're in this world where we feel like we have access to all this information, and we do, some of it true, some of it not, but there's this expectation that we should know exactly how this is going to play out. And you're watching the press corps. I think one of their mistakes is asking the president constantly to get him on the record to say, like, when is this going to be ending? When is this going to be ending? Fact is, we don't know. Even Dr. Fauci doesn't know. I mean, we keep getting these predictions because I think there's this hunger in our society where we have all this knowledge and we know everything already, right? To sort of predict how much longer this is going to play out. I'd say that's almost a more tricky thing going on right now as a reporter who's covering this than the polarization. I'd like to think that in some communities, in some respects, this might lead to less polarization and a little bit less of the me culture of selfies and looking out for neighbors and communities, which is something that people in rural America already do. I mean, the militias get a lot of the news, but they're just a small fraction of rural America. In fact, frankly, a lot of the militias are in suburban areas, including one of the leaders of the movement here in Idaho grew up in the Sun Valley area, which is one of the wealthiest places in America. So, it's not black and white. It's tricky to tell, but I think we've seen that more on a national level immediately, but I think, while they're out, I reported a story at this hospital up in a small town in Idaho a couple of weeks ago, the last time, as it turns out, I would go out on a story in person. And the clinic director told me, look, my husband thinks this is just like, they're just pushing this to get Trump. And this is somebody who's in the medical field. I don't think she thought that way, but I think that's I could be naive here, but I think that we're going to shift away from that, unfortunately, when more people know more people and loved ones close to them who are sick, or, I hate to be grim, but dying. from this. I think that may change. I don't know.
What does
Yeah.
it look like to you, Leila?
Well, I think for me, I constantly think about my role in the sense of what is the public service of what I'm doing, where are we supposed to be as journalists? And that's also sort of what NPR talks about at the top levels. What is the most pressing thing that we need to be sharing with the public, doing for the public in this moment of a virus that, like Kirk was saying, very few people know very much about. It's being learned about in this moment. CDC guidelines constantly changing, a lack of testing so that we don't really know the scale of infections in these urban areas that are dealing with them. But we're also seeing this infighting between the president and governors. We're also seeing a situation where newsrooms are discussing how much of the briefing do you air live and how much do you vet first and then share without, because when you air something unedited, you have to later then come back and say, okay, here's what was true. We fact check now for you, which is the job of the journalist. So those conversations are going on, but I think, we're in uncharted territory, and as we cover this, we're learning and adapting as well to how to do it best for the audience, in the sense of being fair, being accurate, being truthful, and being reflective of what's actually going on, because the divisions definitely are showing themselves, at least at the political level, where you're hearing states say they're not getting enough, or what they're getting is not sufficient. There was that infighting between the White House and the Michigan governor over the weekend. So all of these things, I think, will feed into the larger political landscape, and it may be eventually a great unifier, like Kirk was saying, and I think that's what we're watching for. How does this feed into this very polarized atmosphere that already existed when we walked into this pandemic?
And I would note as well, this is not, a decision that was political. I know that we're not inferring that, but it was from a pure journalistic perspective. Like, when the president is saying things, contradicting himself, and many people aren't able to watch the whole time or able to watch the follow-up to understand what was true and what was not. This is an extraordinary moment we're in, and there were a lot of, this came from the audience up. There were a lot of people who were concerned that people's lives were at risk, that because the messaging was all over the map, especially in the early days, that lives were being put at risk, and this was a real, concern potentially to society. So it wasn't, I think it can immediately get couched because we're in this moment of everything's partisan, and NPR is liberal and Fox is conservative and CNN is liberal. By the way, I'm not necessarily saying NPR is liberal, I'm being glib, but a lot of this came from the audience demanding this and raising this question, and it became a journalistic integrity question. It's our mission to serve the public. It's not necessarily our mission to let something run unchecked. And, in some sense, this is a manifestation of the debate over whether or not what role the cable news networks, if any, played in the rise of Trump by playing his rallies verbatim without much checking of the facts. So we're seeing, it's like Leila said, we're seeing all of this, every challenge is like somehow related to this corona story. It's just very, very remarkable about how some of these bigger picture issues play in and manifest themselves through it.
Well, speaking of questions rising from the audience and serving the public, let's make sure that our audience knows that they can ask questions, and we'll start fielding those. So we're all learning Zoom technology really quickly in these weeks. I believe on the bottom of your screens, there should be a Q&A tab. And if you click there, you can open up and start submitting questions through it. So I hope those are the proper instructions, and you can use the chat room to let me know if I've got that wrong. And while we're waiting for some of those questions to come in from the audience, I'll ask you this. Is there anything that you think is not being sufficiently reported at this point in time that you would like to see further covered? What's missing?
I think that's a really hard question, because this story is everywhere. It's outside my door, it's outside your door, it's at your supermarket, it's everywhere. And so it's actually hard to know everything that's happening in this moment. So absolutely, I think there are stories missing. Do I necessarily know what those stories are? No. For me, just as a consumer of news, I relate to news not through numbers, but through people. And so for me, the stories that really help me understand something is through a person, whether that's a public health official that's grappling with this crisis, or a family that has an entire family that is sick, or these types of things. So I think that actually the answer is, I don't know. I think we're trying to get at the most important stories, but we're also in a moment that I think in a month or two, we'll know more about this moment than we know today.
I would add too, what gives me a little bit of anxiety. Yes, I agree with everything that was just said, but what is not being told? What is not being covered? This is the biggest story and it's affecting everything. But are there stories that are out there? I give you an example. Last week, there was a settlement where PG&E, admitted fault and had to pay millions of dollars, or agreed to pay millions of dollars to victims of the Camp Fire in Northern California, which I spent a good chunk of last year covering. This was buried in the back half of the newscasts, our national newscasts. Whereas if this story hadn't been going on, it would have been huge. I just got a press release pitch to me just now as we've been talking. It's funny you bring this up about, well, the Trump administration, it was from an environmental group saying, and I don't want to parrot the exact press release, but saying, well, even during this national emergency, the Trump administration just delisted from federal protections this species. I would say that yes, it's definitely the most important story of our time and affecting everything. And we haven't even talked about unemployment and the looming potential, the forecast of the depression coming. But there are also other things still happening too. So it's hard to even get those on the air at this point because of the other big sad story.
Well, I think that gets at Ethan's question. He asked in the Q&A, what formerly big issues have fallen to the wayside during the virus? The one that comes to mind for me, and I'll ask you about it, Leila, is that it's hard to keep track of the days now. I think something like a week ago, I believe the militias in Iraq carried out another attack on a U.S. base, and a U.S. service member was killed. And that, of course, was the prelude to a very intense media moment and geopolitical moment just some time back when we thought we were on the verge of war with Iran. And it was hardly noticed during this pandemic. So what are your thoughts about that particular issue, or do you have other issues that come to mind, Leila, in terms of what's not being talked about?
Well, like you alluded to, that was a similar situation where an American was killed, almost led to war between the US and Iran the previous time. And this time was barely, and we covered it on a 24-hour news cycle. And this time, obviously, taking a back seat to COVID. I do think this is the most important story globally. When you look to any country, it's at the top of their newspapers. But like Kirk said, that doesn't stop all the other issues. There is still a war going on in Syria. There is still famine in Yemen. There is still issues over immigration here in this country, one of the most divisive and covered issues of this moment. So all of these stories are still here. And I also think many very aggravated by this moment. So there's all these socioeconomic stories, obviously more aggravated as people lose their jobs. So yes, I think those are taking a back seat because there is only enough air for certain amounts of stories. And so right now, those are all pretty much COVID stories. You're seeing some coverage of other things, but for the most part, everything has taken a back seat.
Michael asks, as journalists, do you have knowledge of public sources that would allow people to get information regarding the rate of infection in their local area?
Johns Hopkins does Johns Hopkins does a thing that you can look city to city, state to state. Also, a lot of local newspapers have done their own compilations, and local news sources have done their own compilations of the area that they're in. So they'll have a COVID tracker. So I would say those have been things I've looked at.
Yeah, the New York Times also has a map that's pretty handy. It's interesting, we're seeing some of these news media outlets in front of the actual government or more traditional sources. I know, speaking from here in Idaho in a rural area, it's been it's taken a long time, and the state health officials have gotten criticized for not properly or quickly or efficiently aggregating some of the data to know just how severe this pandemic is locally. This brings up a whole other host of questions. Do some people in certain places know what to trust in this moment of partisan media and actually fake news sites out there with pushing fake and lies and all that kind of thing? Who do they trust? And suddenly, if our trust in institutions is eroding, we hope anyway that they'll go to those sources that Leila's talking about.
And the other thing is that there is also not that most cities, most states, most countries really don't know the extent of their infection rate. So when you look at that infection rate, those are underestimates according to officials, because the testing is just not there yet. And so a lot of the infection rate numbers don't really mean that much in the grand scheme, because it doesn't mean that's the only people infected. It's just the only people that could get tested. So a lot of the times I also look at the death rates to try to get a better sense of people who've been confirmed COVID as a result, who've died as a result of complications with COVID-19.
Well, speaking of trust and statistical analysis, James asks, we're told that China is already recovering from the pandemic at a fast rate, but can we really fully trust their word given the tight control that the Chinese Communist Party has on the flow of information? And since we're using them as a model for how we might respond here, what are your thoughts on that?
Well, I don't know that, first of all, I don't know that we're using them as a model, because as you can see, people are not being tracked through the streets like in China. And I don't know that that's something that an open society would necessarily want. And I think that is something that's being debated, these lockdown orders, stay-at-home orders, civil liberties versus public health. I don't cover China, so it would be unfair of me to really look at that. It would be unfair of me to say that I know, but I think it's accurate to be skeptical. Just recently a journalist was kicked out of Egypt because she reported that they were woefully under-reporting their COVID cases. So I think it is a legitimate question. I think the case that is really being held up by a lot of experts is the mass testing case that we saw in South Korea. So I think questioning the numbers is a legitimate thing. Is China actually recovering? World Health Organization did go in there and say that that's what they were seeing and did hold it up as a model. But a lot of questions around whether you want your government to track you around your cities and states.
Kirk, you want to jump in on that?
Just to say that, it's a difficult story to report because we don't know what is the only thing we widely know, right, is that there are way more cases than we know there are being reported. I did a story 2 days ago that my editor assigned me. Dr. Birx from the State Department stood up at the press conference late last week and said, look, we have these cities, we have New York and California and New Orleans, for example, that are hot zones, but 40% of the country, she said, actually has very few cases. And that made us think, now is that, yes, they have, there's more than a dozen states that have fewer than 200 reported cases, but you call those states and you find out they all know that it's much higher than that. She was suggesting, the administration was trying to be upbeat and trying to suggest that, well, maybe we don't have to shut down the entire country like what we're seeing in the Northeast, what we're seeing on the West Coast right now. Well, when you call these states and you find out from them, and yes, they're largely rural, unless they're largely red states, that they're like, well, we know there's community spread and we actually need more testing kits, and we don't know. And we, that same day, 2 of the states we talked to shut down everything. So, we can look, it's so hard to look at the data right now in a story and try to make, factual statements or storylines based on the data, because you always have to go back and think about, well, actually, there may be many more cases and we don't know if it's going to go down when it gets hot, or if that's, there's a lot of theories and there just isn't enough research right now.
Leila, Michael asked a question that's about a part of the world you'll be more familiar with. Are you following the impact of COVID-19 in refugee camps in Syria, Bangladesh, Jordan, etc.?
So I actually am on the national desk now, so I am not following those in and out, but our colleagues are. We have somebody covering Syria. They only reported the first COVID case just a week and a half ago. Do I trust that there's only one COVID case in Syria among Syrian refugees? I don't think so. But I actually don't cover those issues. Yeah. But I think as we've seen cluster populations, refugees, homeless populations here in the United States, places where people are on top of each other, prisons, those are all places that are probably not getting the testing, that is already limited, and is a place that could spread easily because people are so close together.
Well, let's bring it back to the domestic scene. Estorisa asks this question. News coverage of Joe Biden's campaign seems to have faded out of sight. How do you see the future of Democratic primary coverage and general campaign coverage?
It is funny. 2 weeks ago, it was the only thing being covered. Go ahead, Kirk.
Oh, I was only going to say, I think what Leila said, we're kind of in this, who knows how long this breaking news situation will last, but this is a whole other question. But a lot of the news media has been, in my opinion, rightly criticized about horse race coverage. This has been going on. I'm guilty of it too. And a lot of that is a lot easier to do when the candidates are having rallies, when there's tit for tats. When we have this big story out here and we don't even have our president holding rallies right now, this is pretty extraordinary. I dare say that it may actually lead to, we've also got a lot of political journalists who are kind of like, okay, what do we do now? It may actually lead to a little bit different campaign reporting than we've seen in the past. Not just whether, the debates, but a lot of it feels as though it's on hold. We've seen a couple of states push back their primaries. It may bolster the case for more voting by mail. But I do think we'll start to see more coverage of Joe Biden in the coming weeks, I would think. I think would you agree? I think we're still kind of in this, we haven't quite figured out what this is going to mean for our country for the next week, let alone the next 2 months.
Right. And I think that our political reporters are continuing to cover the candidates that they have in the past, but obviously this has all taken on the COVID-19 narrative, including those campaigns who are now speaking about this very specifically. I also think it's something to watch as we see with primaries being pushed, watching how this might shift and change elections, if anything is, changed permanently as a result of this. What happens with the national election come November? So I think we're still in the very early stages of this coverage. And that doesn't mean that everything will drop off forever, but I definitely think COVID will be the top line for months and will impact all of these other storylines that we cover.
So we've got just a couple minutes left here. Michael asked a question that I think a lot of people have been talking about and wondering about, and this is a good chance to ask two reporters about their personal feelings on this, I think. He says, does the negative rhetoric by the president directed at the news media have the effect of intimidating the media community? And we certainly hear that it does. It can have a chilling effect. But on a personal level in your work, do you feel that, and how does it play out?
No, I don't feel intimidated by the president. I think that the danger is, I've worked in a lot of countries where when you fully demonize and undermine a free and thriving press in the eyes of the public, you then make yourself the only purveyor of truth, and there's no one there to hold you accountable. So I think that the bigger danger, and I'm speaking about the countries I've covered abroad, the bigger danger is creating a situation where people don't feel they can go to fact-based reporting as a trustworthy source. And that, I think, is the bigger danger, not being intimidated. As you could see at NPR, Mary Louise Kelly, when she was called a liar by the State Department, NPR stood behind her, the CEO stood behind her. The bigger danger is the slow chipping away of trust in this type of work in general, because this is a cornerstone of an open and free society. And if you undermine and kill that cornerstone, then it's impossible to have real accountability.
Yeah, I mean, I was just in an interview the other day. I spend a lot of time with people who have never been interviewed before, and I'm frequently, in case in point the other day, I'm frequently the first reporter they've ever met. They've never met another reporter. They didn't even know who we are. it's a lot easier for people to not have empathy towards something that is kind of out there in the ether. And there is a bit of a difference between what you see on TV in the press corps and then those of us who are correspondents around the US and around the world. Neither am I intimidated. Am I personally offended? Yes. And I have tried to be a little bit more transparent about that recently by saying, you know, this is a move that dictators use all around the world, as Leila said. However, they don't understand what we do, and they probably don't understand what it's like to sit down into that family's kitchen and be, you know, like, let's face it, I probably don't have the same political views as some of their views were, but to sit there, listen to them, hear them tell their story, their side, and lay all the facts out and lay all the views out for someone else to make an informed decision, that's not easy. I'd like to think that we're still doing that. I do worry that news networks, in particular cable news networks, have drifted towards partisanship for financial gain, if nothing else. But I try to less of a rant. I'm definitely not opinionated, but I try to keep in perspective that people like that do not know what it is that we do, and they may see, you know, different people calling themselves journalists or people from outlets that are actually partisan. So it's difficult to tell right now. But I would say that overall, I started off the talk as surprised when I go into some of the smallest towns in America, and sometimes I'll get, you know, name recognition in some of these communities. But yeah, no, I'm not, I don't feel intimidated. Am I frustrated and offended? Sure.
Well, I promised these two that I'd get them out at 1:45 because they have to get back to a very busy schedule. And as Kirk just said, it's not easy doing the work they do. So I want to thank you both for doing that work, for taking the time to be with us today. I want to thank our audience for joining us and giving us some great questions. Listen for Leila Fadel's name or voice and Kirk Siegler's voice on All Things Considered and Morning Edition and on NPR in general. They'll continue to bring you great reporting. I'd like to remind our audience that we've got many more sessions coming from AJU as part of Biahad Together. I'm going to post the website here in the chat so that you can check them out. I know that anybody was interested in or piqued by the discussion about Iran on Thursday night. President Jeffrey Herbst of AJU is going to be talking to two guests about political relationship between the United States and Iran. So that would be a good one to tune into. So thanks everybody for being with us today. And thank you again, Leila and Kirk. And everybody be safe out there.
Sure. Take care.
Bye. Thank you.